Tattoo removal. What really happens inside your skin? Beautiful body art. Until one day you hate it. And if that's you, you're definitely not alone. Around 1 in every 4 people with tattoos eventually regrets getting them. In the United States alone, that's tens of millions of people. Over the last few decades, tattoos have exploded in popularity, especially among younger generations. Many people got tattooed to capture a moment in their life, follow a cultural trend, express individuality, or feel connected to something bigger than themselves. And at the time, it made perfect sense. But people change.
As the years pass, what once felt meaningful may no longer represent who you are. Sometimes the tattoo just doesn't age well. Lines blur, colors fade, or the design simply looks bad. Because of this, laser tattoo removal has become incredibly common, almost as normal today as going to the dentist, which is surprising because tattoo removal is one of the most extreme things you can do to your body. It's a high-tech medical procedure that is extremely painful and causes controlled destruction beneath your skin. So how does it actually work?
What a tattoo really is. From your body's point of view, a tattoo is not art. It's an invasion. Tattoo needles punch thousands of tiny wounds into your skin, injecting ink deep into the dermis. To your cells, these ink particles look like huge foreign objects, almost like massive boulders. Your immune system immediately tries to remove them, but the particles are simply too large. So your body does the next best thing. It traps the ink. Special immune cells surround and lock the ink in place, forming a living prison. When those cells die, new ones replace them, holding the ink in the exact same spot. This cycle continues for decades. That's why tattoos last forever. The logic behind removing a tattoo. In theory, removing a tattoo is simple. Break the ink into smaller pieces so your body can finally carry it away. The hard part is doing that without destroying the surrounding skin. Surprisingly, the most effective tool for this job is a laser. Lasers are a form of electromagnetic energy, just like visible light or X-rays, but far more focused. Different ink colors absorb different wavelengths of light. Black ink absorbs almost everything and is the easiest to remove. Other colors require specific laser types. Even then, lasers are dangerous. Used incorrectly, they can cause burns, scarring, or permanent changes in skin color. Why laser pulses are used? Modern tattoo removal does not use a continuous beam of light. Instead, it fires ultra-short bursts of energy, pulses lasting only trillionths of a second. These pulses are so brief that the energy hits before heat has time to spread. When the pulse reaches the ink, the particles absorb the energy instantly. Their temperature skyrockets to hundreds of degrees in a fraction of a second. The ink expands violently and shatters into tiny fragments, almost like microscopic explosions happening inside your skin. At the same time, water inside nearby cells instantly turns into steam. Cells rip apart. Shockwaves spread through the tissue. Tiny blood vessels rupture. From the outside, you feel sharp pain, hear a cracking sound, and smell something like burnt hair. The skin briefly turns white, a reaction called frosting, caused by gas bubbles forming under the surface. This process repeats again and again as the laser moves across the tattoo. The aftermath inside your skin. Once the laser stops, the real work begins. Your skin now resembles a deep internal burn. Immune cells rush to the area, triggering inflammation. The skin becomes red, swollen, and painful. Blisters may form. Over the next few days, itching begins, a sign that healing is actively happening. This is the moment when tattoo removal truly starts. Your immune system begins clearing away the shattered ink. Some fragments are washed out through your bloodstream.
Others are swallowed by immune cells and transported to your lymph nodes. Some ink leaves your body entirely, while some remains trapped there for life. Because most ink particles are still too large after one session, your body locks many of them back into place. That's why tattoo removal requires multiple sessions, usually between 5 and 12, with weeks of healing in between. Healing and final results. After about a week, damaged skin starts to regenerate. Scabs fall away, revealing fresh pink skin underneath. Over the following weeks, the tattoo slowly becomes lighter as your immune system continues removing ink. Modern laser technology is very effective when performed by experienced professionals. In most cases, the skin fully heals within 2 months. Scarring or permanent discoloration is rare, but only when the procedure is done correctly.
After enough sessions, the tattoo may disappear completely or fade to the point where it's barely visible. The final outcome depends on many factors: the size of the tattoo, the colors used, how deep the ink sits, and how efficiently your body cleans up the damage. What once felt permanent can eventually be erased, one painful laser pulse at a time.